So what I'd like to do is introduce our next speaker, who is Hilda Palmer from the Greater Manchester Hazard Centre. And she is obviously an infamous activist. I'm sure many of you know her, and she's going to be talking through some practical projects that we can work through in the workplace to tackle COVID exposure.
Thanks ever so much. I like the fact that I'm infamous. Can you hear me? Can you see the screen? Is that okay? Can you see the screen?
Yes.
You can. Okay, so thank you. Sorry if anybody was going to actually talk to me there. Okay, I've only got 3 slides. I'm just going to do this very quickly. I hope I am. Let's get in there. Why can't I get in there? Sorry, it's just not working for me quite like I expected. Why can't I just show the slides? Oh, anyway, can you see that? Can everybody see it? I'll just do it. I'm just wanted to say that, you know, thanks to the organisers and all those who've been working really hard to clean the air at work against incredible odds for the last 4 years. There are a huge number of people. I'm not going to name them. Many of them are here today or have contributed to this. And it's really important that we just recognise the work that has been done. As Janet has explained, the Hazards Campaign, Greater Manchester Hazards Centre, and something called TUCAN, the Trade Union Clean Air Network, has been working on clean air in the workplace for many years. And over the last 4 years, we've provided massive amounts of information and training sessions and practical advice to unions, to safety reps, to community groups about trying to clean the air at work. That's what we've actually been doing. I don't need to repeat, I think, what everybody has said. Just to reiterate that we know it's not, COVID is a health and safety issue. It's not over. It's airborne and it spreads in poorly ventilated spaces. And so to reduce its spread, we have to clean the air by ventilation, filtration, source control, such as isolation and sick pay and respiratory PPE. And we need the government, and public and occupational health, and the infection prevention and control people and employers to act. Jonathan has just explained very clearly how they are acting at the moment, but they're acting completely against us. They've capitulated to COVID, and they're doing absolutely, excuse my language, bugger all to protect us, to prevent it. In the workplace, we need to do a whole range of things, but obviously raise awareness, talk and share information and evidence of causes and risks and solutions, collect evidence about the risk factors in our own workplaces, and make the invisible visible by monitoring and surveys, and I'm going to talk a bit about that, organise together to take whatever action we can, whatever seems the most appropriate in our particular workplace, installing commercial HEPA filters or making do-it-yourself filters, increasing respiratory PPE wearing. And all of us have got to be joining together inside and outside the workplace to campaign for higher indoor air quality standards and investment and enforcement to make this work. Now, I just want to talk a bit about monitoring. Ventilation, everybody knows ventilation is really important. Ventilation dilutes, disperses and removes stale air. So whatever's in the air eventually gets diluted and removed. Ventilation has been an enormous problem in workplaces for decades, and workers have been made very ill because of it. COVID exposed this, but it didn't actually cause it. But what it has done is to make it visible, and it's brought us some new tools. Ventilation is quite hard to judge. It's hard to measure. We have to rely on our employer to tell us, you know, what it is. They have to carry out engineering audits or whatever. But what COVID has brought along is the portable, cheap, available, portable CO2 monitor. And why can we use CO2 to measure ventilation? Because when we breathe out carbon dioxide. And it's breathing out that contains the COVID that will make us ill. So breathing other people's air is not a good idea. The more CO2 builds up in the air, the more of other people's breath, possibly including COVID, is in the air, and the higher the risk of getting infection. So if we measure the CO2 level as a proxy for ventilation, it's a really, really quick, easy thing you can do. There are cheap portable monitors around now, and union branches have been buying them. We've been training reps in how to use them. There are a couple here that I use, particularly the Aranet 4 is a gold standard. It's quite expensive, but it's incredibly accurate. And then there's this smart air Qingping, which measures the same CO2 temperature and relative humidity, but it also measures particulate matter, the tiny particles, PM 2.5 and PM 10, which make people really ill. And it's really important when you're campaigning overall for not just getting rid of COVID from the air, but getting rid of all sorts of other particles which make us really ill. Okay, if you look at the, you can also link these portable monitors, you can link them up to your phone and you can get tables or graphs of the daily or weekly CO2 levels, and you can see one down there below, just shows how the level is going up and down. And what does that actually mean? Well, if you look on the left, there's a picture of the Aranet there with a little table which shows how much, what the CO2 level is up the side, up the left side, and then up the right side is how much, what percentage of other people's exhaled air that you're breathing in. So at 800 parts per million, you're breathing in about 1% of other people's air. But at 1500 parts per million, which the HSE says is fine, you're breathing 3% of other people's air, which is 3 breaths for every 100. And if you're at work or in school or in a hospital, that's 8 to 10 hours of breathing other people's air. And in most workplaces, the CO2 levels are far, far higher than that because ventilation in most of our workplaces is absolutely appalling. So what's a good level? Well, people vary, but people differ in what they say about this, but our advice, going from the experts that John has listed, who have been absolutely brilliant at sharing their expertise and their knowledge and their research and their reasoning all through the pandemic, and have proven to be far better than the misinformers, disinformers, liars and dishonest cheats that Janet outlined and Jonathan pictured and shamed in the IPC cell and the government. What we say is that 800 parts per million, below 800 parts per million of CO2 is probably a reasonable level. The HSE even agreed that that was a good level, but they won't enforce anything below about 1500. And at that level, you're not safe from COVID, but the level of risk is massively reduced. Okay, my last slide. But if you can't reduce, if you can't get really good ventilation and you can't keep the CO2 level to that, then what you can do as a temporary measure until we can get better mechanical ventilation is to add filtration. You can filter the air. HEPA filters, high efficiency particulate air filters, and DIY MERV filters, they take out of the air, as the air is drawn through them by fans, they take out of the air all the tiny particles down to about 0.1, it's 0.1 millionth of a meter, which includes COVID, it includes lots of other air pollution factors, pollen, dust, a whole range of things that make us ill. So you can use commercial ones, and the picture on the left shows an NEU conference where we'd made the do-it-yourself one on the left with Councillor Oliver Patrick there, who'd helped to demonstrate that, and on the right some different commercial HEPA filters. And it's really important to get good ones, the ones that the Department of Education advised for schools, were the most expensive, the least effective, and the most useless, along with their completely inadequate spending of £25 million on poor CO2 monitors and then not training or enabling teachers to use them or doing anything about them and collecting the evidence. So you've got to do these things properly. And we have tried to draw all this sort of stuff together in our Toucan Workers' Guide to Action on Indoor Workplace Air Pollution. The link's there. I have put in the chat and in the Google document a link to this short presentation and to some of the other stuff. So there's lots and lots of things we can do. There are lots of really good people who've contributed to this, but it's still really hard work. And in a workshop, we need to talk about this, to discuss the problems we have, the successes we have, what has worked, what hasn't worked in different workplaces. Does it help to link COVID with air pollution issues generally, or with green issues, or with climate change? Does the cost of sickness absence versus the cost of cleaning the air, does that work? At the moment, the cost of supply teaching, the budget for supply teachers, because teachers are off sick because of COVID in schools, is about £171 per child per year, which means that every child could basically have their own Corsi Rosenthal do-it-yourself box and be made safe. Does that work? Is that useful? So I look forward to discussing these things with you in a minute. But thanks very much.